The World Health Organization urging countries to strengthen surveillance and reporting as COVID cases are starting to surge. Joining us for the very latest is Dr. Isaac Bogoch. Dr. Bogoch, good morning. And the WHO calling the resurgence of cases concerning, particularly since we're still in the summer season. Just how big is the current caseload? Do we know? And are we already at the beginning of the fall wave?
Yeah, great point. We are at the beginning of a wave in Canada. I think it's not entirely clear how big this wave will get. But if we look at what we know across the country, we are seeing an uptick in our surveillance systems, like with wastewater. And there is even a bump in the rise in COVID-related hospitalizations now. And I think we knew this was coming. And if we look back at prior years, we saw very similar trends at the tail end of the summer as we move from summer into the fall season. So on one hand, of course, nobody wants to see this. On the other hand, it's not really a surprise. And it's really important that we double down on our efforts to really ensure we have a good understanding of the COVID trends and enable people to make smart decisions for themselves so that they can take steps to protect themselves and those around them.
Okay. Dr. Bogoch, we've also heard that this latest COVID variant could be the best yet at evading immunity.
Yeah, so the technical name is BA 2.86. I think we have to be a little cautious when we're describing it because to my count now, I think there's only 11 cases on the planet. It's been detected in some wastewater surveillance. And certainly when you look at the genetic makeup of this particular variant, yep, it certainly has some mutations that look like it could certainly evade some protection that we have from prior infection or from prior vaccination. It's not entirely clear the significance of this particular variant, if it's going to spread, if it isn't. It's been detected in several countries, and it's been detected in wastewater, but we just haven't seen it with a significant growth advantage to date. Something to watch and certainly keep a close eye on. But I think it's also important to sit on our hands a little bit and wait until we learn a little bit more. There's one right now, for example, in Canada. This is the EG5, which probably makes up more than half of our circulating COVID right now and is in part driving the current situation we have. But I think it's also important to contextualize this, right? Mm-hmm. We're not seeing nearly the same degree of impact that we saw in 2020 or 2021, right? The vast majority of Canadians have been vaccinated and or recovered from prior infection. And of course, we don't want anyone to get infected, but we just can't ignore that most Canadians have been infected and recovered. And that combination of vaccination plus recovery from prior infection is really preventing these massive surges of COVID and the pressures that we've had on our healthcare system that we saw once in the past.
Which is great news, obviously, but maybe as we get set to head into the fall, back to school, back to normal routines, might be a good time for a bit of a reminder, Dr. Bogoch, about how we can prepare for even a possible tripledemic of COVID, RSV, and influenza.
Right. We're going to see respiratory viruses. We're going to see COVID. We're going to see flu. We're going to see RSV. We know that's coming. And of course, COVID's already here. So easy steps, right? Nothing's new, similar to what we've been chatting about for a while now. The vaccines are going to be coming out for COVID, and it's especially important for those at greatest risk for severe infection to get an updated vaccine. We know flu shots are going to come around at around the same time. We're going to have a flu season. We absolutely are. The Southern Hemisphere had a flu season, so it's really important for us to get those flu vaccines as well. Improving the air quality in indoor spaces. Of course, it's not perfect, but we know that's where the vast majority of these infections are transmitted. We can improve indoor air quality. In the absence of mandates, people can choose to put on a mask. And of course, if you put a mask on in an indoor setting, you will reduce your risk of getting a respiratory virus. And one of the most important steps is, of course, stay home. If you're sick, don't go to work. Don't send your kids to school. Stay home. Don't infect everybody else. And it's extremely important that we abide by that. And again, we've been through this before. We're going to go through it again. And we're going to have this exact same conversation this time next year as well. And it's just important that we really adhere to some of these fundamental principles, and we'll do okay.
Mm-hmm. All right. Before we let you go, we were talking about this at the top of the show. Multiple studies showing that dogs have a nose for COVID, among other things. Can dogs be more effective and less expensive in terms of detecting COVID?
I love this story. This is fantastic, right? Here you have a pretty quick way to diagnose COVID. It's all the data demonstrates that it's pretty accurate. You can do this in real time. It's also a very cute and cuddly way to diagnose COVID, if that's a thing. You wonder where something like this could be implemented, and a little bit of creativity. You think you could use this in healthcare settings and long-term care facilities to detect outbreaks before you start to see cases pop up. I mean, I think there's a lot of really amazing use case scenarios. I just like the fact that there's dogs involved. I think that's fantastic, and I hope we see more of them around healthcare settings. It'll make everything better.
Agreed.
All right. Yeah. It turns out I thought I had COVID for a week and I just left 2 cookies in my pocket. I can see that happening. Dr. Bogoch, good to see you as always. Thanks so much for this.